Check 1 2 1 2 3 4. Can you hear me, Lisa? Or do I need to turn it on?
You can be seated. Good evening. As Dean of Louisiana State University Health Science Center New Orleans School of Nursing Dean, I would like to welcome our students, our faculty, and guests to our white coat ceremony. Additionally, I would like to acknowledge the families and significant others and friends who have supported each one of our nursing students to reach this stage in the advancement of their professional studies. I would like to thank our faculty and staff and students who have assisted in making this event possible tonight for our celebration. Before we begin, I'd like to start with providing a brief explanation of what the white coat ceremony significance and the meaning and inspiration is behind the white coat ceremony. The white coat ceremony was originally designed by the Arnold P. Gold Foundation as a way to welcome medical students into the healthcare profession and to set clear professional expectations through the reading of an oath publicly. On August of 2014, the Arnold P. Gold Foundation partnered with the American Association of the Colleges of Nursing and hosted inaugural white coat ceremonies throughout the country. Today, the ceremony is shared by schools of nursing, medicine, and other healthcare professional schools in all states to emphasize the importance of compassionate, patient-centered care, as well as recognizing scientific proficiency. Traditionally, the white coat ceremony is a symbolic robing to remind the students of their commitment to their patients and the promise to engage in patient-focused humanistic care. This ceremony represents the nurse's responsibility to put the interests of the patients first and affirms that this obligation starts on the first day of nursing school clinicals and continues throughout their nursing career. Further, this white coat ceremony is a rite of passage. It's welcoming you, nursing students, into the nursing profession. Some acknowledge and recognize the white coat ceremony as a symbolic conversion of a layperson into an actual member of the healthcare professional team. As nursing students, once you receive and accept this white coat, you are ethically and legally bound by the same professional commitment that binds all registered nurses. This ceremony joins the white coat symbolic virtues of altruism, responsibility, duty, honor, respect, and compassion with our School of Nursing core values, which are stewardship, organizational citizenship, nursing innovation, caring, professionalism, respect, integrity, diversity, and excellence. The white coat will serve as a reminder of your professional obligations and a symbol of your professionalism. The length of the white coat has a significant meaning also. Our students will be receiving a short white coat. The short white coat epitomizes the role of a nursing student as a learner and a novice to the nursing profession. The longer white coat symbolizes the wearer as an experienced member of the profession. So tonight, as nursing faculty and nursing students, we will wear our white coats together symbolically to represent our essential role in providing compassionate care and excellence in the healthcare delivery system. So that gives you a little understanding of what we're here doing tonight, hopefully welcoming you not only into the nursing profession, but also into the clinical aspect of your role of providing patient care and the responsibility that goes with that. So at this point, I get to introduce Dr. Diana Merendino, our guest speaker. She's a 40-year veteran in healthcare industry. She received her Bachelor of Science degree for cardiopulmonary science from LSU Medical Center in 1985. She's worked as a staff therapist, nighttime supervisor, and in-service educator for LSU Medical until 1991. In 1990, while working on her master's in health sciences degree, she taught her cardiopulmonary physiology course and fell in love with the classroom. In 91, she was hired to be the Director of Clinical Education for Bossier Parish Community College Respiratory Therapy Program. She graduated with her master's degree in 1993. In 1998, she moved up to the program director position for the Bossier Parish Community College Respiratory Therapy Program and began the first satellite program for respiratory therapy in the state with Rapides Medical Center in Alexandria, and later added another site in the Monroe, Louisiana area. In 2005, she became the program director for the Cardiopulmonary Science Program And in 2007, she pursued a doctorate in physical therapy, changing from respiratory therapy to physical therapy, and graduated in 2012. Dr. Merendino currently serves as the Associate Dean of Academic Affairs. Along with her administrative duties, she continues to teach courses within the cardiopulmonary sciences, cardiovascular technology, and physical therapy program. Dr. Merendino is able to participate in the faculty clinical nursing using her licenses and skills as both a PT and respiratory therapist to treat individuals with underlying cardiopulmonary dysfunction. After work, Dr. Merendino loves spending time with her husband, Tommy, their 3 daughters and their husbands, and 6 grandchildren. She loves gardening, piecing together quilts, watching LSU sports, always, and reading in her spare time. It's my privilege to welcome Dr. Diane Merendino to the stage.
Thank you, Dr. Porsche. And so as nursing students, you're probably going, we don't even have a nurse up here talking to us. But let me tell you something. My mom was a 30-year nurse for the VA system. So I was brought up in a household with a nurse who was a supervisor and then transitioned from supervisor back to a staff nurse in the ICU on the night shift, where she finished her 12 years. So 30 years of nursing. I will tell you that my mom did try to get me to go into nursing. I hope I don't offend anybody. I couldn't do poop and vomit. I could do snot. And most of my nurses can't do snot. So we each have our own. And in regards to going back to work on a doctorate in physical therapy, I was not discontented with my respiratory therapy job. We wanted to offer a pulmonary rehab program in our clinic, and respiratory therapists could not and still cannot charge in that environment. So I wanted a doctorate. I went back, and a year before I graduated, Medicare came in and set up new guidelines and said, thou shalt not do pulmonary rehab in an outpatient rehab facility. And I was like, what have I got myself into? But I do see patients in our outpatient facility, and they all have underlying cardiopulmonary dysfunction. So they couldn't walk from here to that door without getting short of breath. And those are the individuals that I focus on. And if they can't get from here to the door because of a hip, then I kindly refer out to the orthopedic PT who takes care of them. So we make sure all our patients get taken care of. But what I really wanted to talk to y'all about today is getting these right coats is very, very significant. And transitioning from the classroom into the clinic is an exciting time. I remember being a student, and I don't know if you feel like this or not, sitting there going, I don't think I'm ready for this. I don't think I know enough to be able to do this. They have laid a foundation for you to build on. And notice I'm using the term to build on because most of your learning is about to get real. And what I mean by that is when you go into your classroom, you know what's on schedule for the day. You know what the topic is. Most of you know what the chapter is. You should have read. I have to tell you, I wasn't an upfront reader. I was a behind reader because I needed my lecture first. But when you walk to bedside, you don't know what you're going to get. You kind of have a clue, oh, they're coming in with difficulty breathing. They probably smoked their whole life. It's all about, their smoking history, and that's their problem, only to find out that maybe they had a deep vein thrombosis and now they've got a pulmonary embolism, and that's what's making their difficulty to breathe. So your learning is about to grow in leaps and bounds. The other thing that I want to point out is you won't always have the answers. You will be at bedside. There will be something going on. and maybe your clinical instructor asks you, maybe it's a physician standing at bedside that says, what do you think? And you're standing there with deer in the headlights going, I don't know what to think right now. And you know what? That's okay. But what you need to do is go, that's a very good question. I haven't thought about, we need to research that. We need to explore that a little bit more. I need to go and research this. Your learning, again, is just beginning. I'm a 40-year veteran, and I am still learning. The day, and I say this with all sincerity in my heart, the day that you say, I'm done learning, is the day you need to find another profession, because the medical profession is consistently changing. New technology, new ways of treating things. So you will never be on top of everything. There will always be something on the horizon coming. Think about COVID. That caught us completely out of the blue. I hope we never see another pandemic like that. But if we do, we're going to be on the cusp of trying to learn what it is and how do we address that. So understand that you won't always have the answers, but you will have opportunity to seek out information to help you get those answers. Be an active member of the healthcare team. I know my cardiopulmonary and even my physical therapy students, what do you mean I got to call the doctor and ask him this? You need clarification on this. I need you to pick up the phone and call and find out what he wants. I will never forget the night I was working in an ICU. I needed current ventilator orders. The physician had come in there and manipulated the vent and conveniently left and didn't write orders. And we have to follow orders. So I proceeded to chase him down. And somebody said, he's not going to be happy with you. You know what? It's not about me at the end of the day. It's not about him at the end of the day. It's about my patient at the end of the day. And if that means calling and I get an earful, or as I say, he took 10 pounds off my behind, that's okay. Because you know what? It wasn't about me. It's about that patient. Never, ever lose that focus. You are their advocate, okay, as part of that healthcare team. I know many of you, if I could listen to interviews over the years and you ask, why do you go into this? Individuals will say, because I want to help people. I need to help people. I need to help people. And there's nothing wrong with that. But let me give you something else to think about. Instead of saying I want to help people, why don't you say I want to make a difference? Because we know that some of these individuals that we are going to care for will not leave the institution. Okay? So how do you help somebody who's terminal? How do you help somebody who's terminal and not physically with it? They can't answer you, they can't communicate. And so I always tell my students, it's not about helping, it's about making a difference. Maybe you didn't make a difference, for that patient. Maybe you made the difference for the family member. Maybe you were able to answer some of their questions that nobody else gave them the time of day to answer. I know this sounds really, really silly, but as a respiratory therapist, I had a patient that actually hooked up a breathing treatment with a mask, and I said, I will be right back. I've got to run down the hall and drop off this piece of tubing. And he looked at me and he said, you won't be back. He said, that's how people treat, we won't be back. Now, this is a true story. So I literally go from this end of the room to that end of the room into the other patient's room. The patient is sitting there. I have the tubing. I hook him up, and he says, I need the bedpan, and nobody has answered the buzzer. So I went to the nurse's station, and they said, We got a problem with the patient at the end of the hall. The nurse is tied up. And I said, okay, y'all tell me where to find a bedpan. So they sent me to the closet. I get in there. Guess what? No bedpan. So I go back to the patient's room, and I said, we ain't got a bedpan. He said, can you get me to the commode? And I said, yes, we can do this. We got halfway there, and guess whose oxygen tubing wouldn't reach? And he said, I've gone past the point of return. I said, okay. So we took the oxygen off. I sat him on the commode. He wanted to chitty chat, and I said, you need to shut your mouth, do your business, conserve your oxygen, because I can't get oxygen to you. Needless to say, this process took a good 15, 20 minutes. So then I had to go back to the other patient's room. And I said, I know you thought I wasn't going to be back. And I told him the story of what I had just done for this other patient. And he looked at me and he said, well, I wish somebody would help me to the bathroom every once in a while. And so he was very, very understanding. So go the extra mile. It's the little things sometimes that makes the world a difference to these individuals. Communicate with your patient. Listen to them when they tell you something. And yes, there have been times I've walked in a patient's room and they're yelling at me, and I'm like, you know, I'm sorry, I can only do so much, and I'll try to do better, or we'll try to do better. And I mean, they're having a bad day. Well, you know, when they've been up in that hospital for 4 and 5 weeks, every day is a bad day when they're trying to get home. Or I had this was PT, this patient, I needed to get up and walk. He goes, I walked this morning. I said, if you want me to write your discharge orders, you got to walk with me. So he got an attitude. We started walking. We got halfway through our walk, and I said, what is bad? He had just got a prostate cancer diagnosis on top of what he thought was having a stroke. And I said, you know what? We just need to take one day at a time, and we need to work through this, and it's going to be okay. Then I get him back to bed. He's happy, and guess who forgot to walk him upstairs? And my preceptor said, no, you're not going back in there. I said, I most certainly am. Oh, I can't believe yeah, we're fixing to do that. I can't discharge him if he can't do stairs, and he's got stairs at home. So I went in there, and I had a wheelchair, and I said, we're going to ride to the end of the hall. You're going to show me you can do stairs, and we're going to ride back. Take the time, do what's right, and do what's best for the patient. Make that difference, okay? You should be looking at your patient as it is one of your most beloved family members. I don't care how much money you have when I treat you. I don't care how big, small, color, old. I don't care any of that. That I'm here to make you better. Nothing else matters to me. It's just like I'm treating a family member. Treat that patient like you want your family members treated. Never lose that sight. I'm not going to say you won't have a bad night every once in a while, but keep that in the back of your mind. So, again, out of 40 years, I always said, if they came into my office tomorrow and changed the locks and wouldn't let me back in as my associate dean, I'd go back in a New York second and work bedside care. I did not leave bedside care because I didn't like patient care. I love patient care. And when I was working on my physical therapy degree, my last year was 30 weeks of care. And my husband said, I've never seen you light up so much in your life. Not that I don't light up with my students, because when I see the light bulb go on for those, I light up for my students too. But my motto and goal is to make a difference. I may not make you well. It may not get better. Some of my patients, I think this year I've buried 2 of my patients because of their terminal lung disease. But we always try to find the up point of it. What can I do to help you through this process? I want to end with giving you this quote. I was doing rounds with a surgery team in the surgical ICU next door, and I was going in as a physical therapist. And so he had his residents, his interns, there was nursing, there was me, there would be an RT standing there. He would gather us all at the end of this 21-bed unit, and he would say, who's got the quote for today? Well, of course, the first day he said that, I thought, I don't know what you're talking about. But after listening a couple of days, I went prepared. I went in, we were going to do rounds. He said, who's got the quote for today? My hand flew up. And he said, okay, what are you going to share with us? So listen to this. Every day, focus on your purpose. Remember why you do what you do. We don't get burned out because of what we do. We get burned out because we forget why we do it. I'm sorry. Keep that in mind. And you'll go far. Thank you.
I think what you've experienced tonight is really the motivation that we get from providing care. I know a lot of times we say a lot of things, but it is truly a privilege to be with patients from the beginning of their life to the end. And it is really a privilege for you to have that experience. And I know we talked a little bit tonight about the patient, but one of the things about nursing, we don't just take care of the patient. We take care of everyone that comes with them. That means all the family members, significant others, and everyone else. And it is an awesome experience and opportunity, but it's an incredible responsibility too. So thank you, Dr. Marandino, for your inspirational words. So this time we'll begin with the commencing of the cloaking of our students. And to assist with the cloakings, Dr. Jelenia Jackson, your program director for our off-campus instructional site and Shreveport campus, Dr. Sheena Youngblood, and Ms. Chastity Malin, instructors of clinical nursing for our OCIS Shreveport campus. During their cloaking, our students will be publicly acknowledged with the reading of their names. Each student will receive a white coat pin, the pin from the Arnold P. Gold Foundation, and a pin from the LSU School of Nursing. You can wear both of these pins in clinical, too, to make sure that everyone sees that you have your white coat. The School of Nursing pin was designed with our core values listed on them to remind you to not only live out the core values of the Arnold P. Gold Foundation, but our school. And it serves as a visual reminder of your oath and commitment to providing that high-quality care and excellence. Students will be assisted with the signing of their names in the ceremony book archives, and also remember that tonight represents your obligation to and dedication to providing that humanistic, patient-centered care. We'll begin with the ceremony.
Okay. All right, first up is Riley Belts. Latasha Brookins. Caitlin Graham. Cameron Knox. Brandon Lewis. Stephanie Lofton. Ricky Love. Destiny Wynn. Juan Thompson. Fahad Wakas. Averiana Williams. Patrick Winterton. Now I'd like to introduce the CARE Class of 2026 class president to read our white coat pledge, Stephanie Lofton.
It should be on the back of our program. Alrighty. As a nurse dedicated to providing the highest quality care and services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns, act in a compassionate and trustworthy manner in all aspects of my care, apply my knowledge, experience, and skills to the best of my ability to ensure optimal outcomes for my patients, exercise sound professional judgment while abiding by legal and ethical requirements, accept the lifelong obligation to improve my professional knowledge and competence, promote, advocate for, and strive to protect the health, safety, and rights of the patients. With this pledge, take this oath voluntarily with the full realization of the responsibility with which I am entrusted by the public.
Thank you. You can be seated. At this time, let's give our students one more congratulations. I invite all the family members also to hang around after the ceremony. We have some cake in the back to share with you to celebrate the accomplishment tonight. And as I like to say, not to the students, but to the family, the next time we will be here, and I will probably be in your presence, will be much more joyous opportunity where they'll be graduating, we hope, and getting their diploma. So congratulations to entering your clinical experiences, and next time we're all together as family with the administration, you'll be crossing that stage. So I invite everyone to celebrate with us, and it's to honor our white coat recipients at the reception, and this concludes our ceremony. So everyone be safe and travel home very safely. Thank you.